the same question that's being asked previously, but in a different way. Does the proposed plan require anybody to be dropped off the Oregon Health Plan?
Does the require anybody to be dropped off?
Does Oregon, people are saying people will be forced off the plan, but does it reduce eligibility or do anything else non-monetarily that forces these people to be dropped off?
So I've learned that the semantics of this question are really critical, so I'm going to try and be very clear. It does not force people off the health plan. I think when you look in the document, you will see numerous examples of HCA, ACA, and what the financial impacts are at different categories. So, for example, if someone makes $12,000 a year and this policy goes into effect as law, then is someone saying to them, you can't have health insurance?
Are they saying you can't have Oregon Health Plan insurance?
Well, what we're saying is, first of all, there's a question whether the state can cover as many of those people, but what I also gathered from your question is that, is someone telling them, now you can't have health insurance? I think you'll see in this report, the question is, how could they have health insurance? How would they purchase it with that level of income?
Well, the reason I'm
Which
asking,
is
people are,
different than someone saying, you can't have health insurance.
well, people are using the terms, they're being forced off. And to me, that's not accurate. Is it more accurate to say the state does not have the money to continue for them to be on health insurance?
One way to say it would be that there would not be sufficient subsidy for them at their income level to maintain health insurance.
Okay.
There's another piece that's just practical, and that is how the process works today. So today there's a 12-month eligibility period. The new plan says there's now a 6-month eligibility period. So that means people have to re-enroll at 6 months. There's some challenges with getting people enrolled every 6 months, just in terms of practically, do we have current addresses? Do they respond in time? There's also the removal of a retroactive eligibility that's a requirement right now in Medicaid plans. So today, if somebody would submit an application, it wasn't complete, it took a little time to get all the information, their coverage lapsed. When that application was complete, there's a retro eligibility process that would put them back on coverage in 3 months, 90 days. So there's that piece is gone. And then there are new documentation requirements. So the administrative barriers and requirements in the new plan make it much more difficult for people to retain that continuous eligibility. So it is anticipated, based on years of experience, that very few people will actually be able to manage to that continuous eligibility. That's separate from the financing challenge of paying for them.
So you think a majority of the people in the expansion population